Paris, Chicago public school students are set to return to the classroom in less than 2 weeks as the COVID-19 Delta variant is driving cases up across the city. The rising case count has put another wedge between CPS and the Chicago Teachers Union, which says the district is stalling on needed safety guarantees. This as CPS mandates that all teachers and school staff be fully vaccinated by October. Joining us now with more is Jesse Sharkey, president of the Chicago Teachers Union. Jesse, welcome back. I know that you were at the bargaining table with CPS today. And of course, there are some places where the two sides agree, but COVID testing and health metrics seem to be some of your biggest points of contention. What is CTU's concern there?
Well, first of all, Brandon, thanks for having me. And yeah, I mean, we're concerned that the mayor and the city are trying to roll back a number of health protections. So, for example, they want to decrease social distancing. They want to get rid of the metrics that we would use for potential shutdown if the situation in the schools gets worse. So we're not willing to go backwards.
As we've discussed, COVID cases continuing to rise in Chicago. Because of that, should that August 30th date for students to return to classrooms, should that be pushed back?
Well, at this point right now, we're going back into schools. We have our clerks in school buildings return tomorrow. Teachers are going back for professional development next week. And so, I think we're going into the school buildings. The state has made it clear that they expect school to be run 5 days a week in order to get credit for running school. But I think it's very much an open question, two things. Number one, whether or not parents send their kids into schools. And number two, very importantly, whether they stay open. And that's something that we think is really important. And I think in order to get that, it's going to be important for the mayor to collaborate with stakeholders and come to the table in good faith and try to hammer out agreements.
On that note, what are you hearing from parents with regards to whether or not they feel safe sending their children back to school? What are you hearing there?
Well, a lot of worry because the Delta variant is super concerning. And while it's true that Illinois has hospitalization rates that are way better than Florida or other parts of the country, this is something which is as contagious as chickenpox, has bad health outcomes, and we have extremely low vaccination rates among the exact communities that make up the people who go to the public schools in Chicago. So we recently just FOIA'd information from the health department among Black students ages 12 to 17, the vaccination rate there is 12%. So, and then among adults in a number of school communities, also very low vaccination rates in the 20s and 30s. So these are vulnerable kids, vulnerable populations, and we really need to have all the safety things in place in order to have schools start safely.
Now, we know CPS has mandated that all teachers, school staff, vendors, that they all be vaccinated by mid-October, but will not require students to do the same. Here's Interim CPS CEO Jose Torres speaking about that today with CDPH Commissioner Dr. Allison Arwady.
The first day of school is Monday, August 30.
Yes.
And we want all children to come, and no test required, no vaccination is required. We will be providing tests and opportunities for testing beginning that first week.
And Jesse, we know that students are often required to have vaccines to enroll in school. Should CPS require that students over the age of 12 receive the COVID-19 vaccine?
Well, I think eventually they probably are going to go there. I think that the issue now right now has been just how little access and how little penetration into a bunch of communities in our city vaccine is made very little headway. And so, what we've been asking for is that CPS set a goal. They've now agreed to set a goal, but then the next part of that is once you have a goal, you have to actually have a really robust plan to get in there and run vaccine clinics in every school in a neighborhood, and then go through the city that way. It needs to be systematic, and so it's like mandating something but not having a systematic way to make it happen isn't any use. And so, we've been very much asking CPS to set up the plans to deliver vaccine. We've been asking for 100 vaccination sites a week to be set up in schools. CPS has made some headway in that. They're a little closer, but we're still not there yet.
At what threshold of COVID cases and positivity rate do you think CPS should shut down remote learning? Should they, or return to remote learning, excuse me?
Also, two things. First of all, the state has to do something there because the state has mandated full return to in-person school 5 days a week. And so, CPS has to operate under state rules. But I think that this is one of the places where we need political leadership from the mayor. She has to say that we can't just let, if this virus is surging. So, for example, if the positivity rates are similar to what they were last fall, say going into October, November, if hospitalization rates start to go up into dangerous levels, those are the times when the mayor should say very clearly, we shouldn't be running in-person school because that's going to be infecting and, potentially, doing grave harm to the communities that depend on public schools.
So Interim CPS CEO Jose Torres, he's been on the job for a couple of months now. Do you have confidence in his leadership ability, especially with so much uncertainty heading into the fall?
Well, he's the interim CEO. The real leadership in the schools has always been through the mayor's office. It's the mayor that appoints the school board. The CEO serves at the mayor's pleasure. And so, this is a situation where it really goes back to the mayor. They can't say, well, we have interim CEO, it all rests on him. I mean, it has to go back to the political leadership in the city.
And with all of that said, though, what about the full-time CEO? I think the mayor had hoped that someone would be appointed late in July. We're still awaiting word on who that might be, but who would you like to see, or what kind of leader would you like to see in that role?
We think that we need someone who has been an educator, who knows the public schools. It would be great if we had someone who is familiar with Chicago. And I know they're working on that. And I know one of the other things they said is that we might have this interim for a little while they made that when they made that search and found the right person. And that would be okay with us. I mean, I think that it's more important that they do the job well than they do it quickly. That said, this is very much a situation where the mayor's leadership matters. Partly because the questions about public health, that come into the school communities aren't really isolated in the school communities. The thing, if transmission of this virus starts in the schools, it's going to wind up back in the neighborhoods. If the Chicago Department of Public Health isn't working closely with the schools, it's going to be hard to get our vaccination targets met. So, in lots of ways, a lot of this goes back to the mayor, at least between now and when we get an elected school board.
Okay. CTU President Jesse Sharkey, thanks again for joining us. Jesse, all the best.
Thanks for having me.